Hi everyone, this is Hethir Rodriguez from naturalfertilityinfo.com, and in today's video I'm going to speak about progesterone cream and PCOS and how to use progesterone cream for polycystic ovary syndrome. So many of you, if you're watching this video, you probably have a clear idea of what PCOS is, but basically PCOS is a syndrome where the body is not ovulating, and because it is not ovulating, it causes a lot of the other hormones in the body to become out of balance. So, for instance, every cycle, the body is producing follicles and preparing for ovulation, but because the body's not ovulating and the progesterone doesn't go up, because after ovulation the progesterone is triggered to go up, then the body thinks, oh, I didn't ovulate, let's push some more hormones, let's push some more estrogens and androgens out into the body so ovulation occurs. And so this cycle happens, and what happens is that the estrogen and the androgens, the levels end up being really high, whereas there's no progesterone because that part of the cycle does not get triggered because there's no ovulation. So you end up with an estrogen dominant situation here, and there's some other hormones that are also involved, but estrogen dominance being the main culprit. So how progesterone cream comes in to use is progesterone cream can help to oppose that estrogen. It can help to mimic a cycle for the body, so the body can get a break and it can kind of renew itself, and the hormones can get balanced so that the cycle can work on its own eventually. So progesterone cream is very, very helpful for PCOS. Dr. John Lee, who was the doctor who brought progesterone cream education to the masses and where I get a lot of my information and inspiration from, he was saying that with PCOS, he felt that with progesterone cream, changes to the diet, and exercise, PCOS could become obsolete. So that's very, very inspiring. And I'm going to share with you how to use progesterone cream with PCOS. So again, this is just for educational purposes. And these also come from Dr. John Lee. So first is how to, there's a couple different ways of using progesterone cream. In a previous video, I showed you how to literally use progesterone cream. The various progesterone creams that were available, like we have our Fertility Progesterone Cream, which comes in a pump, a dosage pump, and then we have also the Emerita Progest Cream, which comes just in a tube. So those are the progesterone creams that we suggest and we've seen work very well with our clients. And so how you use it, you will need to watch the previous video. It'll show you where to rub it on your body and how to use it. But what I'm going to share with you is how to use it specifically for PCOS, because you're going to use it a little bit differently than someone who's just generally using progesterone cream. So there's a couple different ways of using progesterone cream. The first is that there's something that's called a suppression cycle. And so basically what this is Dr. John Lee used this with his clients, where he would have them use progesterone cream from days 7 through day 26. And basically what this does is this suppresses ovulation. And this allows the body to have a rest. You would do this, he would suggest this for 3 or 4 months, and it would just give your body a complete rest so that you would be able to not have the cycle of eggs being produced and not being released, and then the cycle of the hormones of estrogen and the androgens being increased, and then the lack of progesterone. So what happens with this is this kind of tells the body that it's pregnant, and it stops that normal hormonal cycle and it gives it a rest. So what was suggested for this cycle was between 60 to 100 milligrams per day of progesterone cream. So that would be, you would want to split that into 2 parts and apply 1 in the morning and 1 in the evening. So if you were, for example, using 60 milligrams, you would use 30 in the morning and 30 in the evening. So after about 3 or 4 months of the ovulation suppression, then what would be done is you would use the progesterone cream to mimic what a normal cycle is supposed to look like. And some women skip the ovulation suppression because maybe they don't have severe PCOS, or they're trying to conceive and they feel like they don't have enough time to do that. Or this is just what you do after the suppressing ovulation cycle, is you would take the progesterone cream and you would begin using it on day 12 of your cycle, and you would stop using it on day 26. Because after day 26, by stopping it, it'll help the progesterone levels to go down, which will help to trigger your period to begin. So you're going to mimic a normal cycle. I know a lot of you don't have a day 12 because you don't menstruate, so you don't know when to start. You're going to make and create your own cycle using this method. So you would create a day 12, and you would, mark it on your calendar, and you would discontinue use on day 26, and then wait a few days and your menstruation should begin, and then you would continue to mimic it. If your menstruation doesn't begin, still mimic a normal cycle, act like there is one on your calendar, and then on day 12 of the next month you begin the progesterone use again. And so this can be used for many months in a row. You do want to take a break every once in a while. So if you're doing this for a period of time, for a few cycles, then you're going to take a break for a few months to see what your body's doing, because after a while your body's actually going to catch on and it's going to be able to do and create this cycle on its own. As long as you're doing this in conjunction with changes to your diet and adding exercise and also reducing the xenohormones from your life. And we'll talk about that in just a minute. So that's how you use the progesterone cream. You can either use it to stimulate a normal cycle, or you can have a resting period where you suppress ovulation for a period of a couple months, and then you begin mimicking a normal cycle. Now, how you apply progesterone cream is very important. You need to rotate the areas of the body that you are applying the cream to. So for instance, one morning you're going to apply it to the back of your hands. The next, in the evening, you can apply it to your arms. The next day you can apply it to your stomach. And the day after, you can apply it to your thighs. Then you can apply it to your chest. So you need to rotate the areas that you're applying the progesterone cream so that it doesn't get concentrated in one area. And then something else that's really important is with PCOS, diet is going to be actually of the utmost importance. Progesterone cream is second. Very, very, very helpful. But without diet, you're going to have difficulty helping to balance the hormones, because a lot of what is causing PCOS, one of the main factors is insulin resistance, is your blood sugar levels going up and down, and not being balanced. So diet needs to be just as important. But then again, exercise is very important. And the reason for this is if there's excess fat in the body, if there's a lot of fat in the body, those are turning into estrogens and androgens. Those are being used, and the more excess fat that's in the body, the more estrogen there's going to be in the body. So that's another reason that exercise is so important for PCOS. And then one last thing I want to kind of give note to is there's also some herbs that are very helpful for PCOS that help to nourish the endocrine system. The endocrine system is the system that regulates and balances your hormones. So something such as Vitex or Maca you may want to do some more research into. And I cover those in other videos. And so last, one of the very other important things, I know lots of important things in this video, is xenohormones. I've written about this a lot, but basically xenohormones are things from our environment, such as plastics that we store our food in, plastics found in water bottles, hormones found in meats and dairy, and also pesticides. All of these things from our environment, they mimic estrogen. So it's important to avoid them and to begin looking at your life and taking these things out of them. So instead of using plastic to store your food, and use glass. Instead of using plastic water bottles, have a reusable glass water bottle or stainless steel water bottle. These things are constantly leaching into your food and adding to the estrogen dominant problem. So read about that on the website. I have a bunch of articles, about that. I'll put some links below so it can be easy for you to find. But you want to start, it's a lifestyle change. PCOS is thank goodness you can overcome it and you can become pregnant. But you have to make lifestyle changes. It's not something that you can just take a pill for. But all of these are very healthy lifestyle changes in your pregnancy, and your health will be better off with it. So I hope you found this video helpful, and if you have any questions, go ahead and ask them at our natural fertility community, which you can access by going to naturalfertilitycommunity.com, and you can ask any questions you have about this, and we'll be more than happy to help you. I hope you have a great day. Bye.